the first of 2 videos on pregnancy, childbirth, and the pelvic floor. Please watch the videos in order for best results. So, you want to know more about pregnancy? Well, we think you'll want to know about the pelvic floor, a marvelous group of muscles that supports your baby during pregnancy. To find them, touch your pubic bone and then touch your tailbone. The pelvic floor is between them. They're the same muscles that support your bladder and your bowel. Now back to pregnancy. This can affect your pelvic floor muscles. Think, stretch and soften. Why? One cause is pregnancy hormones. They relax your joints and back muscles to support your baby and prepare for birth. Another cause is constipation. That happens when you're pregnant, and it can strain the pelvic floor. Pressure on the pelvic floor makes lots of pregnant women pee more or leak pee a little bit without meaning to. Think, stretch and soften, pee more often. Now, your type of birth can further affect your pelvic floor, with more stretching or possibly a tear. For example, if you have a vaginal birth that takes long or gets unsafe for you or your baby, the doctors may have to help the baby out. To do this, they may use forceps or a vacuum. Either one of these can cause tears in your pelvic floor. If you deliver by C-section, you won't get these tears. However, C-sections have other risks. Ask your care provider so you're well informed. Since the pelvic floor is made of muscle, you can work to keep it strong. If you maintain a strong pelvic floor during pregnancy and childbirth, this will mean fewer problems as you age. On the other hand, if your pelvic floor gets weak, this can cause your bladder, your uterus, or your bowel to drop lower into your vagina. This can cause more peeing or even pooping when you don't mean to. It can also cause you to feel pain or weird feelings during sex. These problems aren't normal if they persist for more than 6 months after childbirth. So what can you do to avoid them? First, know if you're high risk. If you're older than 35, overweight, do a lot of heavy lifting, or cough a lot, your pelvic floor is more likely to bother you. Next, get to know the Kegel exercise. This is an exercise for everyone to strengthen the pelvic floor. This little trick can prevent lifelong problems, long after pregnancy and childbirth. To do a Kegel exercise, first find your pelvic floor muscles. To do this, imagine you're trying to stop yourself from passing gas or peeing. When you do this, you should feel a lifting and tightening around the vagina and the anus. Next, do what they call a slow squeeze. Squeeze and lift slowly. Try to hold each squeeze for 10 seconds, then let go for 10 seconds. Repeat this 10 times. Then do the fast squeeze. Squeeze and lift as quickly as possible. Hold for 1 second, then let go. Repeat this 10 times. Relaxing in between slow or fast squeezes helps make sure your muscles won't become tight and painful. Try to do Kegel exercises 3 times a day for at least 6 months. Try doing them while you're sitting down to eat or when you go to bed at night, so you don't forget them. After 6 months, you can do Kegel exercises less often, like twice a week. This should be enough to maintain your new pelvic floor strength. One more thing, don't do Kegels at the same time that you're peeing. Also, don't squeeze your bum cheeks or thigh muscles while you're doing them. If you want help, ask a physiotherapist. Many are experts in the pelvic floor. Your obstetrician, family doctor, or midwife can also help. A pelvic floor specialist is called a urogynecologist. They can help too, if needed. So remember, the pelvic floor muscles get weaker during pregnancy. You can prevent problems by doing Kegel exercises. Healthcare providers can help keep your pelvic floor strong and healthy. In our next video, we talk more about childbirth and what you can do to avoid serious injuries and speed up recovery. Hint, we're not done talking about the pelvic floor.